Hello everyone. So today we'll be learning about the effects of diabetes on pregnancy. So first we'll divide it into two broad divisions, that is maternal, and next is the neonatal, and then is the fetal complications. So first, maternal complication. First, as we know, with increased blood sugar levels, there is increased chances of infection. So what are the infections commonly that occurs? This can be asymptomatic bacteriuria, UTI, vulvovaginitis, pyelonephritis, and candidiasis. So these are the very common infections, etc. Now next next complication, moving on to the next complication. So what happens is that in case of GDM or in over diabetes mellitus, what happened that the placenta is huge. And why this placenta is huge? So what happens when there is increased blood sugar levels in mother, so it gets transferred to the fetus also. And when glucose moves from mother to fetus, so it drives water with it. And how the water driving occurs? So the water gets driven to the fetus through placenta only. So maternal hyperglycemia leading to fetal hyperglycemia. So this glucose, when passing through this glucose, while it passes through the placenta, it drives water with it. So what is it called? This is called as glucose induced osmosis. So what happens? Glucose induced osmosis. So, and this also leads to polyhydramnios. So what happens? How the polyhydramnios is occurring? So when there is increased blood sugar level in mother, it leads to increased fetal blood sugar level. So fetal hyperglycemia. So this fetal hyperglycemia will lead to polyuria leading to polyhydramnios. So our next complication is polyhydramnios. So first one was increased propensity of infection. Second one is polyhydramnios. Now moving to the third complication. So the third complication is PIH or preeclampsia. Now what happens due to glucose induced osmosis that is occurring through this placenta? So it impairs the trophoblastic invasion. This trophoblastic invasion causes what? It causes uteroplacental insufficiency. This uteroplacental insufficiency can lead to IUGR, PIH, preeclampsia, all this. So we can understand now how this GDM can lead to IUGR, PIH and preeclampsia. Next, moving on to the fourth complication. What is that? So this polyhydramnios leading to what? Polyhydramnios. So polyhydramnios leading to the uterine distension. So this uterine distension can cause what? It can lead to early onset of labor. So early onset of labor, what is it called? It is called as preterm labor. It is occurring before 37 weeks of gestational age. Other complications which can occur are premature rupture of membranes, PPH. Why this PPH is occurring? So this uterine distension can lead to uterine atony. Uterine atony can lead to PPH. This preterm labor can lead to PROM. Again, this uterine distension can also lead to PROM. Now, so moving on to the seventh complication. This was the sixth complication. Now, seventh is the 50% of the patients who are having GDM in their current pregnancy, they have got the chances of developing diabetes mellitus in future too. Therefore, patients with GDM should be regularly screened for the blood sugar levels even after delivery. Now we'll talk in the next slides now how we'll monitor and all that. Now main point is follow-up should be done. Follow-up is necessary.